One of the most important things that we can do for taking care of our casualties is assessing their mental status. So if we know that somebody is unconscious and we run up on them, their eyes are closed, we don't really know what's going on with them, then we need to start checking to see what's wrong. And one of the best ways that we can do that is to talk to our casualty. We need to ask him questions that he can respond to so that we can kind of get a gauge of where he is at. If we start to get weird responses, then we can understand that maybe they're not getting enough oxygen to their brain, and we need to figure out why that is. Do they have a head trauma? Do they have a bleeding problem where they don't have enough blood in their body to carry enough oxygen to their brain to support their consciousness? So we need to start thinking about that. If I ask John Paul a couple of questions and he responds in a way that doesn't make a lot of sense to me or doesn't fit the situation, I'm going to start to get concerned, and I'm going to want to start looking for reasons why that's an issue. Additionally, while I'm talking to John Paul, if he is responding to me, then that gives me a good clue that his lungs are working well enough to push air through his vocal cords so that he can speak, and that also he is conscious enough for us to get a good response from him and an open and patent airway. So we don't have anything obstructing his airway, and he's able to breathe okay for right now. That could change in the future, but at the moment, we can kind of start getting a gauge for what it is that's going on with him with a few simple techniques. The last thing that we're going to talk about is a painful stimulation. If we do a sternal rub, we just take our knuckles and very aggressively and hard rub it up and down on his sternum, it's going to hurt. So we want it to hurt because we want to see if we got a pain response. If we do that and he just says, hey, what the heck, man, I was taking a nap, leave me alone, then we know maybe he doesn't need our help at this moment. But if he has zero response to that, or maybe just a groan, then we know something bad is going on and we need to take care of him as quickly as possible.